Okay, and getting back to second line, what regimen do you prefer for second line?
So if I've given, and I give the majority of patients FOLFOX and bevacizumab as first line, then I give patients FOLFIRI and bevacizumab as second line, assuming they have not had any serious side effects from the bevacizumab.
Okay, and what about third line?
And then third line, well, if they're KRAS wild type, then I would give them irinotecan plus an EGFR inhibitor. If not, if they're mutated, then I would use regorafenib at that point.
Okay, great. When would you choose regorafenib over something else?
Well, I think we have to use regorafenib the way it's been studied and on label, which is after a patient has progressed following a VEGF inhibitor, an EGFR inhibitor if they're KRAS wild type, an oxaliplatin-based chemotherapy with a fluorouracil, and a irinotecan-based chemotherapy with fluorouracil. So really, we have to respect the label and really do that. And that really is what I do. Currently, it is given as a single agent, and it is given either third or fourth line.
Great. And in your experience, does it improve survival?
No, I actually did start using regorafenib really early on after it was approved, and it was a way to give patients an option that wasn't merely recycling an old chemotherapy. And it's an oral option. Patients could take it at home. By this point, patients are they actually have had a lot of chemotherapy. And with the infusional chemotherapy, they've been on pumps. And even though we generally have an excellent relationship with the patients, I think they've had enough of seeing me after a few years. And I think taking an oral agent at home is very welcome. But more importantly, an oral agent that has been shown to work after patients have progressed with these chemotherapies is very encouraging. It does give patients the freedom to stop if they are not able to tolerate. But I find that with communication, the patients are able to tolerate it, meaning communication about the side effects. And it has indeed improved patients' quality of life as well as improved survival.